Thank you. First of all, I would like to thank for having the opportunity to tell you about this project. And I would like to thank PEROSH, Jean-Michel, Manon, and Margarete for organizing this. And I also would like to thank the HSE, Andrew, Chris, and David for planning it so good. And it has been a terrific post so far. And I will try to not disturb that. Actually, 24 hours ago, in this room, I was in the audience and listened to Andrew, Margaret, Stefan, and Carol Black in order. They all talked about the same subject, but with different angles. And it was about cooperation. The need of cooperation to bring good research out from the universities or the institution out to the public. And this project is exactly that. And I'm very happy to stand here because this is a cooperation project within PEROSH with the name of Lessons Learned from COVID-19. And this highlights the importance of this organization. PEROSH is based on cooperation, and we need to continue that, and we should be safe and handle it well in the future. This project, I would say it's important for it's important of 3 reasons, maybe 4 for me, because I have learned a lot from it also. But it's actually the project itself is very interesting because it's very complex and it has been a lot of people involved during. The other thing is the actual result from it, and the third thing is the reason for it. It's lessons learned. We should keep this in our shelves and grab it the next time the prize is coming up. This picture is the project members in the team. And we have had a quite hectic year. We have met 3 times in Europe, in Paris, in the Netherlands, and in Berlin in the last 10 months. And we have, between that, had a number of project meetings online. So it has been quite intense the last year. So, this cooperation is, we are 7 countries, 7 institutions that has worked together with this for quite a long time. And it is the Swedish Institute, the Swedish Agency for Work and Environmental Expertise. It's BAUA from Germany. It's SAWEE from Poland, TNO, the Netherlands, INRS from France, HSE from the United Kingdom, and AWA from Austria that has been in this project. I was thinking, or my plan was to brag a little bit about this project that started 3.5 years ago. And it has been hard work during that time. But since Professor Marty van Tangengren yesterday presented an ongoing project that started 35 years ago, I dropped that. So, but anyway, we started 3.5 years ago with this, and it's actually started by the former chairman of PEROSH, Louis Laurent. He came up with the idea directly after the pandemic, and he invited the PEROSH members to a meeting. And from that time, the INRS and SAWEE in Sweden has been leading this project all the way to the end. And actually, I'm quite happy to have this in my hands right now because it actually was finished last Friday, so it's not even dry. And it has been a hectic summer to finish this one, but we're standing here, we have it in our hands. So the purpose with this was from the beginning and is still that we should not forget anything about the COVID-19, even though it's yesterday's news and we don't want to be reminded of it, but it's interesting if and when the next crisis comes. We will have this like a book to help in the next crisis. So, and the purpose was to analyze the workplace safety and the infection control. And it was a focus on the workplaces and OSH issues. This is not anything for the broader public area, it's for just work environment, OSH issues. But what you see here, when I hold this, is actually just a little small part of it. This is just the last month of work when we compiled it. I printed out this. It's actually, we have produced 7 reports, national reports, or national case studies from these 7 countries, which is the base for this one. So altogether, it's a huge work with a high number of pages written about it. And when we started this project, we just decided how should these individual national report be and what should they cover. And afterwards, we have had it work with how to collect all the data to get one report that is of interest for Europe and for the future. And it has been we have looked into the differences and also the similarities in the countries. Both from the beginning, it was differences before, and it was difference what kind of measures that we take. And just to bring you back in time, we should know that we didn't know much about this virus. When it started, everyone was fumbling in the dark. And every country tried different things all over the world, and also in these 7 countries. And, but quite early in the pandemic, every country realized that the workplace was actually a key factor for it. Because that was a place where you could spread the disease, but it was also a place where you could protect the persons. And it was also not just on the workplace, it was also traveling back and forth to the workplace. And in many countries, the OSH issue actually became part of the infection strategy. So the companies and the institutions had a huge role when it came to the COVID-19 pandemic and how every country dealt with it. And from that point of view, we find 5 specific areas of interest that we should summarize these 7 reports. And it was a social context at the pandemic onset, workplace measures, the effect of the measures, and the retrospective conclusions and the last, which is the absolute purpose of this, the lessons learned from COVID-19. And in the report, you will find different national responses, because every single country had their own way to deal with this. And just to take one example, Sweden, where I come from, we took a completely different approach than the most countries in the world. We didn't lock down at all. We kept all schools open, every workplace open the whole time, which differs a lot from other countries. But there are other differences as well between the countries, and it is similar results. And you can also see it was the division of responsibilities that varied between the countries, so it was not so easy to compare every and each country with each other either. And the national actors and institutions played a key role in when we try to deal with this pandemic. So, and we also need to have in mind that every single country had a huge difference even before. We didn't have the same opportunities, for example, working at home. Some countries had a fiber system spread out in the country, even to the summer cabins, and some didn't have that possibility. So this kind of remote work wasn't as easy in all countries as it was in Sweden. But the workplace measures was, first it was hygiene and protective equipment, like masks, and they put up like walls between work desks and so on. And the remote work was the big issue in many countries, but that was quite uneven. It was uneven between sectors, it was uneven between countries, and it was also uneven between genders, actually. And the strength versus the weaknesses of the strategies is the same there. We can see similarities between countries, but we can also see differences in this report. And if we look at the effects of the measures and look at it from a long-term point of view, we can see that the pandemic actually has changed something in the society that is still there. If I take Sweden, for example, the pandemic did that the remote work is so much more common now compared to before. So many people don't go to work. They work the majority of their time at home. And I would like to say here that this is a little bit of a warning for me. And this is our job to keep tracking this, because we don't know what's happening in the future. Is this good for us, or is it something that we think is good for us? So we need to have our eyes open when it comes to that. And also the digitalization. I don't know, but I didn't know what Zoom and Team was 10 years ago. I didn't know it. It was something that came directly at the pandemic. You should start, I was at the university at that time, you should start giving your lectures with Zoom. I don't know what it is. So, but it was very easy. We came into it, and it stays. And we also see a stronger OSH integration. So, the most important thing, maybe, is this. The lessons learned. So, what should we do next time the crisis is coming? It's like everything, I would would say. It's a preparedness. We need to prepare and we need to be flexible. We can see that the workplaces that was well prepared and was flexible, even though it was not meant to be for an infection, they were prepared for other things. They could easily switch and change the workplaces in a good manner, and they managed the crisis much better than others. We can also see that the OSH is connected to the infection control, and we need to strengthen that link in the future. And as I said, the need of spreading the information between countries, between continents, cooperation is key in this. And we need to know also that we have said crisis instead of next pandemic, because we are not sure what's happening. It could be something else that we should deal with in the same way or in a similar way, which also is of importance. And of course, strengthen the European collaboration, and here PEROSH has a quite big, they can play a big role. My last slide is this. I would like to thank these people, because when I see these people with the list, I see a dream team. For me, it's a dream team, and every single name you see there has been essential for this project. And we have argued, we have worked hard, we have laughed, we have produced 7 national reports, and we have produced this lessons learned report. But most important, we have had fun, we have laughed together. And I'm happy for it, and I would like to thank you all. I see a few of you here in the room, in the chair, for example. Thank you very, very much. You find this report at the SAWEE homepage. You will find it next week or the week after that on PEROSH homepage, and you will find all these national reports there as well. So if you would like, you can start with this one, and if you would like to dig even more, you can take these as well. So thank you for listening.